If you've got a herniated disc in your back or your neck, you might be considering having surgery to solve the problem. Today what I want to talk about are the 3 things that you must consider before taking the big step and going under the knife to get that surgery. I'm Chris Forster, I'm from the Headache and Pain Management Centre here in Brisbane, Australia, and today I'll be talking about the 3 main things that you need to consider. And number 1 is all about actually what's on the scan itself. So if you've got a protruding disc, you've got an extruded disc, you've got a sequestration of the disc, you've got all of these scary words on the scan. It's really important to note that just because you've got that on the scan doesn't mean that that is the cause of your pain. The reason why I'm saying that is because 40% of people actually have a problem with their disc in their spine, but they're pain-free. Okay, so we need to ensure that the symptoms are matching up to what's on the scan before we even think about going under the knife for a risky surgery. Okay, so that's number 1. Number 2, when it comes to the herniated discs, the protruding disc and these sorts of things, what we know is that conservative treatment of those sorts of injuries, okay, and that means physio, that means strength, that means perhaps even an injection beforehand, they are really good first steps to get into the groove of rehab straight away. Okay, it's very, very rare that I would send someone for surgery straight away for a disc injury, unless it's the blatantly obvious. I've just lifted a 120 kilo weight. I've all of a sudden lost feeling in my leg and I've no longer been able to go to the toilet properly. Okay, that would be an example of going straight to surgery. But if it's been there, you've had pain for a very long time, it's been, perhaps months or years since the pain came on, and you've decided to have that scan and the scans come back with what's on there, I think it's really important to get that conservative treatment first. And the reason why is because A, the conservative treatment might actually cause the pain that you're in to go away in the first place. Secondly, what's been shown now in the research is that some discs are actually able to reabsorb the protrusion or even the extrusion into the disc on the conservative treatment side of things, okay? And the third thing about it is if eventually that when, you might have done a few weeks worth of treatment with a physio to get it strong, to get things moving, to build the muscles around the spine as it is, if the pain's not better and the symptoms are still there, you're a much better chance of getting a good outcome from surgery because you've done the prehab before you go under the knife, okay? So you see, when you've got issues with backs anyway, okay, you've got back pain, the muscles do shrink around the area where the back pain is, and it's the same in the neck as well, okay? If you're rehabbing those muscles properly, okay, those muscles are as strong as they can be before you go under the knife, the chance of having a successful surgery goes up and up and up because you've got the strength already to deal with the massive injury you're going to get from actually getting a knife and cutting into your skin and the muscle to get that surgery done. Okay, so there's a lot of things to consider before you get the surgery. Now, with patients we see here at the Headache and Pain Management Centre, what we find is that we don't send to surgery straight away unless it's an absolutely obvious case, like I mentioned before. With most people, what we do is we're looking to rehabilitate the spine properly, okay, either with the multi-cervical unit with the neck or with the Med-X machine with the back, with a combination of other strength exercises and equipment that we have. We recently sent a patient away for surgery, it would have been 3 or 4 weeks ago, where they came in for 6 weeks. Their pain was better, but it just wasn't quite getting to where it needed to get to. Got the scan, there's the protrusion there, and sent away for surgery. Just had the surgery last week, and all of a sudden the pain and the numbness and tingling and everything is now gone. Okay, so that was a very successful case, and he'll be coming back in very soon to get the rehab to get him back to full function. So when we send people to surgeons, they get the job done, they come back and get rehabbed, and then it's all sorted. So if you are considering surgery, please consider getting the conservative treatment first. Get it strong around the area that you're looking to get that operation on. You might just find that conservative treatment gets the job done without the expense, without the risk of going to surgery, and you've just saved yourself a whole bunch of time and a whole bunch of money and a whole bunch of risk by getting it done conservatively before you go under the knife. And of course, if you do need to go under the knife, then please make sure you rehab it properly, okay? Get strong, do the exercises, and make sure you rehab it so that you don't have to do it ever again, because hey, surgery is not a small undertaking. You need to get it all done properly, okay? We don't want to go in for repeat surgeries And worse, you don't want to have to get surgery and it doesn't work the way that you want it to. So consider those things. Conservative stuff, get the surgery done only if it's warranted, and then rehab it really, really well from there. I hope it's been really helpful once again. We've got plenty of stuff on our Facebook, our Instagram, our YouTube, years and years worth of content there. So please visit at HPM Centre at all of those platforms. And I've been Chris Fawcett. I'm the Director of Headache and Pain Management Centre here in Brisbane, and we're all about strong solutions and smarter physio. See you next time.